Okay, picture this. Your dog, your best buddy, is having some serious tummy troubles.
Mm.
It's that ongoing saga of soft poops, maybe a little mucus, even a hint of blood.
Hmm.
Look, it's a situation way too many of us dog parents know all too
Oh,
well.
absolutely. It's worrying.
Well, today, we're diving deep into a surprisingly simple strategy that could be, well, a game changer for a specific type of chronic digestive upset in dogs, the humble fiber.
That's right. We're focusing on what veterinarians call fiber-responsive large bowel diarrhea. It sounds maybe a bit
A
technical,
bit of a mouthful, yeah.
but the key thing is that for some dogs with persistent diarrhea, just, adding more fiber to their diet can make a really remarkable
It
difference.
sounds almost too easy, doesn't it? Like just adding a spoonful of something and poof, problem solved.
Well, yes and no. As we'll uncover, there's a bit more to it than meets the eye, and the science here is still developing, actually.
Right. So this deep dive pulls from medical research looking specifically at canine fiber-responsive diarrhea treatment. And what's fascinating, and maybe a little surprising, is that the body of research isn't huge.
No, it's not.
Just 3 reports in dogs, covering around 83 cases total. That tells you this is an area where, we're still learning a lot.
Exactly. And for you listening, the real value here, I think, is gaining insight into a potential reason behind your dog's chronic diarrhea and, importantly, a possible way forward.
Yeah, just knowing this exists can be a real source of relief when you're worried sick about your furry family member.
Definitely. Feeling empowered with knowledge helps.
So let's break it down. What exactly is fiber-responsive large bowel diarrhea? What's the core issue here?
So in essence, it's a long-lasting case of diarrhea chronic that originates in the large intestine of dogs. And crucially, where the initial cause isn't immediately clear,
Idiopathic, right? That's the term.
idiopathic, yeah, meaning of unknown origin. The defining characteristic, the thing that gives it its name, is that these dogs get better when their diet is supplemented with fiber.
Now, this isn't the first thing your vet will likely jump to, is it? It's not like they hear diarrhea and immediately say, more fiber.
Oh, definitely not. It's what's known as a diagnosis of exclusion.
Okay.
Think of it like medical detective work. Your veterinarian has to systematically rule out all the other known culprits behind chronic large bowel diarrhea before landing on fiber responsiveness as the explanation.
Right, checking off the list.
Exactly. They'll be looking for more common causes first.
Interestingly, the research touches on a possible link to stress. It suggests this condition might sort of overlap with what we humans experience as irritable bowel syndrome.
Sometimes called nervous colitis, spastic colon, or mucus colitis.
That rings a bell for a lot of us pet owners, I bet.
Oh.
That connection.
It really highlights that, intricate connection between a dog's emotional well-being and their gut health. It's not just about what they eat.
Fascinating. Okay, so who tends to be affected by this fiber-responsive diarrhea? Are we talking puppies, senior dogs, specific breeds?
Well, the research shows that dogs of really all ages can be affected. The range is pretty wide, from young pups around 6 months old all the way up to senior dogs of 14 years.
Wow.
The average age, the median, is about 6 years old.
Under breeds.
It's quite a mix, actually. While mixed breeds are commonly seen, certain purebreds do seem to appear more frequently in the reports.
Like who?
German Shepherd dogs, miniature Schnauzers, Cocker Spaniels, and those popular miniature or toy poodles.
Okay.
So, if your dog falls into one of these categories and you're dealing with ongoing diarrhea, this is definitely something to keep in mind and discuss with your vet.
That's really helpful info for owners of those breeds, yeah. Now, what are the key signs? What might point towards this specific type of diarrhea? What should owners be looking out for?
The signs are pretty typical of issues in the large intestine, the large bowel. We're talking about soft to liquid stool. Often with schnesmus, that's the straining to defecate. They look like they're trying really hard.
Okay, straining. Got it.
You might also see excess fecal mucus and even hematochezia, which is just the medical term for fresh blood in the stool.
Red blood, okay.
Frequency is another important clue. These dogs tend to need to go more often than usual. The median reported was about 3.5 times a day.
And urgently.
Yes, often with a real sense of urgency, like they just can't wait.
And it's not always consistent, is it? I read it can come and go, which must be particularly frustrating for owners trying to figure out what's going on.
Exactly. In many cases, maybe most, the diarrhea is episodic. It alternates with periods where their stool is totally normal.
Huh.
But it's important to know that in about a quarter of cases, the diarrhea can be pretty constant, just ongoing.
Are there other, maybe less common signs?
Yeah, there are a few. Things like occasional vomiting, sometimes a decrease in appetite, specifically during those bouts of diarrhea, signs of abdominal discomfort or pain, and even anal pruritus, which is just itching around their rear end.
Itching, right. What's interesting is that the research notes that weight loss is generally not a typical sign of this condition.
That's true, which might be a bit of reassurance for worried owners, if their dog isn't losing weight despite the diarrhea.
But what I found particularly striking was that connection to stress and a dog's personality you mentioned earlier. Can you tell us more about that?
Yeah, this is a really fascinating aspect. The research suggests that in around 35% of dogs diagnosed with this condition, there were identifiable stress triggers or what were described as certain personality traits.
Like what kind of triggers?
Think about events like having visitors over, traveling, moving house, maybe nearby construction causing noise, introducing an invisible fence.
Ah, okay. Big changes or disruptions.
Exactly. Or even a recent change in the household, like an adoption.
In personality.
On the personality side, dogs described as generally nervous, high-strung, overly sensitive, maybe those with noise phobias, or even dogs exhibiting aggression, anxiety, or signs that could be interpreted as, sort of, depression, were more commonly reported in these cases.
Ah.
It really highlights that gut-brain axis, that well-recognized pathway where a dog's emotional state can directly impact how their digestive system functions.
Yeah, it's a real eye-opener, isn't it? You might be so focused on what they're eating that you overlook what might be going on in their environment or their little doggy brain.
It's a powerful reminder that their emotional health plays a big role in their physical well-being, for sure.
And what about when the vet does a physical exam? What do they typically find? Anything obvious?
Interestingly, the research indicates that a standard physical examination usually doesn't reveal any significant abnormalities specifically related to the GI tract in these dogs.
Huh. So no obvious lumps or pain points necessarily?
Not typically, which is part of what makes diagnosing this condition a bit of a puzzle.
Okay, so we have a picture of who might be affected, the symptoms, but what's the underlying cause? What's actually going wrong in their system to cause this fiber-responsive diarrhea?
Yeah, that's the million-dollar question, isn't it? Unfortunately, the precise causes are still unknown.
Really? Still unknown?
The research is quite clear on this point. However, as we've discussed, stress and maybe certain personality traits are suspected to play a role in some instances.
Acting as a trigger, maybe? Or making them more susceptible?
Possibly, yes. Acting as a trigger or making a dog more susceptible. But the exact mechanism isn't worked out.
Okay, so getting a diagnosis sounds like, as you said, a process of ruling other things out. What other conditions does a vet need to consider and eliminate before concluding it's fiber-responsive diarrhea? The list sounds like it could be quite long.
It is indeed a process of differential diagnosis, and the list is pretty comprehensive.
Okay, like what?
Well, first, simple things like dietary indiscretion. Maybe they raided the trash can or ate something weird outside.
Happens all the time.
Then there are conditions like highly digestible diet-responsive diarrhea and hypoallergenic diet-responsive diarrhea, where specific food changes usually lead to improvement, so you try those first.
Right, food trials.
Exactly. Parasitic infections, especially whipworms, need to be ruled out carefully. Sometimes they're hard to find on tests.
Okay.
Then there's diarrhea associated with an overgrowth of bacteria like Clostridium perfringens.
Clostridium, right.
Inflammatory conditions of the colon are big ones, things like lymphocytic plasmacytic colitis and eosinophilic colitis.
So inflammation is a key thing to rule out.
Definitely. Along with other less common types of colitis, irritable bowel syndrome itself needs consideration.
Which might overlap, you said.
It might, which makes it tricky. Then more serious things like colonic neoplasia, that means tumors in the colon, like adenocarcinoma, lymphoma, or adenoma.
Okay, scary stuff.
And even something less common like cecal inversion, where a part of the intestine folds abnormally.
Wow.
So as you can hear, arriving at a diagnosis of fiber-responsive diarrhea involves a significant process of elimination. It's definitely not a quick conclusion.
No kidding. It's real detective work by the vet. That really emphasizes how thorough a workup needs to be.
Absolutely.
And what about standard lab tests and imaging, like X-rays or ultrasound? Do you usually provide any clear answers?
Generally, no. The research shows that routine blood work, the CBC, biochemistry profile, and a urinalysis usually don't show any consistent or specific abnormalities in these dogs.
So the blood tests are often normal?
Often normal, yeah. They do note that occasionally you might see a slightly higher number of eosinophils, that's a type of white blood cell, but that could point to other things too, like whipworms, eosinophilic colitis, or food allergies.
Not specific then?
Not specific, no. And when it comes to imaging, like abdominal x-rays and ultrasounds, these are typically within normal limits as well in cases of fiber-responsive diarrhea.
So the usual tests might come back normal, which must be confusing.
It can be, yes.
So what diagnostic procedures are then typically used to pinpoint fiber-responsive diarrhea, given the standard tests aren't much help?
Well, several steps are usually taken. Vets often start with a dietary trial using a highly digestible GI-specific diet for a few weeks, maybe 2 to 4.
To see if that helps.
Exactly. If that doesn't improve the stool, they might then try an elimination or hypoallergenic diet trial for a similar period to rule out food sensitivities or allergies.
More diet changes.
Yep. They'll also likely run a specific fecal test, an ELISA, to check for toxins made by Clostridium perfringens.
Okay.
And importantly, administer a broad-spectrum deworming medication like fenbendazole to make absolutely sure whipworms aren't the problem, even if initial fecal exams didn't show them.
Because they can be tricky to find, right?
Very tricky. Multiple tests might be needed. So if none of these steps resolve the diarrhea, a colonoscopy might be recommended.
Going in with a camera.
Exactly. And interestingly, in dogs that turn out to have fiber-responsive diarrhea, the colonoscopy often looks normal. Or it might show only very mild, non-specific changes, like the lining looks slightly more granular or fragile, but nothing dramatic.
Huh. Even the inside looks okay.
Often, yes. And then finally, biopsies taken from multiple areas of the colon, from the beginning near the cecum right down to the rectum, are examined under a microscope. And these typically show normal results, too.
Wow. So you rule out infection, inflammation, parasites, food issues, tumors, structural problems, and if everything looks pretty normal despite the diarrhea, then you might consider fiber.
That's essentially the process, yes.
Yeah.
It's about excluding everything else before you land on this diagnosis and try the fiber therapy.
It really sounds like they have to rule out pretty much everything else. So we've gone through all that detective work. Now for the potential solution.
Yeah.
How is fiber-responsive diarrhea actually treated?
Okay, so the main treatment, as the name implies, is supplementing the diet with fiber. And this is usually managed outpatient, at home.
Right.
The research specifically recommends starting by adding 1 to 3 tablespoons daily of psyllium hydrophobic muciloid, which most people know by the brand name Metamucil.
Metamucil, okay. Added to what? Their regular food.
Typically added to a highly digestible GI diet initially. And it's good to know that a standard tablespoon of Metamucil powder contains about 10.2 grams of psyllium. That helps with dosing.
And why psyllium in particular? What makes it so effective for this specific type of diarrhea?
Good question. Psyllium is a type of soluble fiber, and it works in a few important ways. First, it absorbs water in the intestines, which helps to bulk up and solidify loose stools, improving their consistency.
Soak up the excess water.
Exactly. And secondly, it undergoes fermentation by the good bacteria in the colon. This process produces something called volatile fatty acids.
Okay.
These fatty acids are actually a vital energy source for the cells lining the colonocytes. They help keep those cells healthy and functioning properly.
So it helps the stool and feeds the gut lining.
Precisely. The average effective dose reported in the research is about 2 tablespoons per day, or if you want to be more specific, roughly 1.13 tablespoons per kilogram of the dog's body weight, or 1.3 grams of psyllium per kilogram.
That gives people a good starting point. The research also points out that starting with lower amounts of fiber, or maybe trying other types of fiber initially, might not work as well.
That's what the study suggested, yes.
Yeah.
That psyllium at these kinds of doses seem to be key for that initial positive response.
That's a good tip for owners. Don't give up too soon or start too low, maybe? And what about the long term? Can dogs eventually go off the extra fiber once things settle down?
It seems possible for some. In about half of the dogs that respond well to psyllium and stay diarrhea-free for, say, 2 to 3 months, it might be possible to gradually reduce the amount of fiber they're getting.
Slowly taper off.
Slowly taper, yes. Some owners might also try switching to a commercial dog food that is naturally high in insoluble fiber once the diarrhea is under control with psyllium. It might just be more convenient.
Right. Easier than adding powder every day.
Could be. However, the research does caution that in about 50% of those dogs switch to a high insoluble fiber diet, the diarrhea can return, so it doesn't work for everyone.
Okay. Something to watch out for.
And similarly, once the psyllium has resolved the issue, owners might be able to transition off this special, easily digestible GI diet and onto a high-quality maintenance dog food.
Back to regular food.
Potentially. But again, it's crucial to keep a close eye out for any signs of the diarrhea coming back during these transitions.
Constant vigilance. And what if the fiber doesn't seem to be making a difference at all? What might that suggest to the vet?
Yeah, if there's no initial improvement with adequate fiber supplementation, it might raise the suspicion that the underlying issue causing the chronic large bowel diarrhea is actually irritable bowel syndrome, or IBS.
Ah, back to the IBS possibility.
Exactly. In that case, the treatment approach would likely need to be different, possibly involving specific medications to manage the IBS symptoms rather than just fiber.
Okay, so fiber is the main treatment, but are there any other important things to consider, like other medications needed or potential side effects of adding all this fiber?
Well, the research indicates that there aren't any other specific medications that are typically needed for fiber-responsive large bowel diarrhea itself. The fiber is the treatment.
Good.
And fortunately, fiber supplementation doesn't seem to have any known negative interactions with most common medications dogs might be on for other things.
That's good news too. Less complicated.
Definitely.
Mm.
Follow up with your veterinarian is important, though. They'll want to check on your dog's stool quality regularly, maybe through recheck exams or even just phone updates.
Keeping tabs.
Yes. And if stress was identified as a potential factor early on, addressing those stressors is really crucial for long-term success.
Right, managing the environment or anxiety.
Or if there were noted personality traits, like nervousness or anxiety, behavior modification might be recommended alongside the dietary changes.
Makes sense. Treat the whole dog. Any side effects from the fiber itself?
The main potential one mentioned is increased flatulence, gas.
Ah, the Metamucil effect.
Pretty much. It can happen with soluble fiber like psyllium. If this becomes excessive or problematic, the dosage of fiber can usually be adjusted, maybe reduced slightly, to minimize it while still controlling the diarrhea.
Good to know. Finally, what's the overall outlook? For dogs who are diagnosed with fiber-responsive large bowel diarrhea and treated with fiber, what's the prognosis like? Is it something they'll struggle with forever?
The prognosis is actually very good.
Oh, really?
Yes, the research shows that approximately 85% of dogs with this condition have an excellent or very good long-term response to fiber supplementation.
85%. That's huge.
It really is. So for the vast majority of these dogs, it's a very manageable condition with a positive outcome and, a good quality of life once you find the right fiber balance.
That's really encouraging news for dog owners who might be pulling their hair out dealing with this frustrating issue.
Absolutely.
So to recap our deep dive today, the key takeaway seems to be, for a specific type of chronic large bowel diarrhea in dogs, one where other causes have been ruled out, simply adding fiber, particularly psyllium, can be a surprisingly effective treatment.
That's the core message.
But it's so important to remember that getting a proper diagnosis from your veterinarian is the first and most crucial step. You have to rule out those other potential underlying causes first.
Absolutely critical. Don't just start adding Metamucil without a vet's guidance.
Right. And it really makes you think, doesn't it, about how closely we need to pay attention to our dog's digestive health, their environment, maybe even their personality. Have you, listening out there, noticed any of the signs we've discussed in your own dog? Could there be any underlying stress factors in their life that might be playing a role?
It's kind of remarkable how sometimes these seemingly simple dietary adjustments can have such a significant impact on chronic health issues. It often prompts us to consider solutions that go beyond just traditional medications or complex treatments.
Yeah, it's a good reminder that sometimes the most effective answers are, well, surprisingly straightforward, hiding in plain sight like a tub of fiber.
Exactly. Simple but powerful when used correctly.